Good evening, and thanks for tuning in to our stats video this week. My name is Sara, epidemiologist at the Jefferson County Health Department. Tonight, we are going over the week 42 COVID-19 data. The CDC week 42 covers data from Sunday, October 11th to Saturday, October 17th. The weekly total COVID-19 surveillance report includes our community-based cases, as well as those long-term care facility cases. During week 42, we had a total of 346 confirmed and probable COVID-19 cases in Jefferson County. Our year-to-date total is 5,564 cases, and that was as of Saturday, October 17th. We are reporting 66 COVID-19 associated deaths, as well as 20 outbreaks in the long-term care facilities. Let's start with the number of confirmed and probable cases by week in Table 1. Column 1 shows that CDC week, and in column 2, you'll see the CDC week start date. During week 42, we had 346 confirmed and probable cases, which is an increase from last week's weekly case count. It's actually the first increase that we've seen in a few weeks. In Figure 1, we see the confirmed and probable cases by week in bar graph form, which helps to show how our weekly case count is moving. And again, up until last week, we had actually seen a pretty nice downward trend. The next chart shows a breakdown of the daily case numbers and that 7-day rolling average of cases. The actual number of cases per day is seen as indicated by that dotted blue line, and the solid blue line is the 7-day rolling average. This 7-day rolling average of cases is one of the main indicators that is used for that color guidance chart for our county, and our 7-day rolling average of 49.43 cases per day, which is 21.97 cases per day per 100,000 residents. It keeps us in the orange status for this week. Next, let's look at the overall age group data in Figure 4. The 20 to 29 year age group now has 912 cumulative cases, and the 80 plus age group has the highest rate per 10,000. Each of our age groups experienced around a 5 to 8% total increase in cases. In Figure 5, we will be looking at the fatalities and the fatality rate by age group. There are 66 reported deaths in our county, and most of those have been in our 80 plus age group. Our cumulative fatality rate in Jefferson County is 1.19%, and this rate is both lower than Missouri and the US. Missouri's fatality rate is 1.64%, and the fatality rate for the US is 2.69%. Moving on to Figure 7, we have the COVID-19 PCR test results by week, as well as a visual of the percent positive rate. This data only includes those lab confirmed cases, so the number will look different from that main weekly case count because it does not include those probables. The percent positive is currently sitting at 11.8, which is an increase from the past few weeks. Table 3 is where we can see the total number of positive tests, negative tests, as well as the values for our weekly percent positive. During week 42, we had 324 lab confirmed positive cases. This number does not include the probable cases, and it also does not include any duplicate test results. Each individual person is only counted once, no matter how many positive test results they receive. The percent positive for week 42 is 11.8%. This number will likely change over the course of the next week or so as we continue to get those negative results in from the state. But 324 positive tests is higher than the numbers we've seen the past couple weeks, so I wouldn't expect that percent positive to drop any lower than probably about 9% based on the average number of total tests that we've been seeing the past couple weeks. For the zip code data this week, we will see the cumulative number of cases in each area shown in blue, as well as the active cases in each area shown in orange. The active cases are those new and recent cases that are currently under investigation and in the process of completing their isolation or quarantine period. We have a few areas who have higher amounts of cumulative cases, and these areas are Arnold, DeSoto, Benton, Festus, and Imperial. Many of these same areas also have a high number of active cases at the moment as well. Two particular areas have over 100 active cases, and those areas are Arnold 63010, who has 160 active cases, and Imperial 63052, who has 122 active cases. And for the last piece of our main weekly surveillance report, we will look at our cases by zip code for 10,000 residents. The rate per 10,000 takes that population of each individual zip code into account. So this does help give a better comparison among some of those areas who have higher populations or smaller populations. So as you can see, Herculaneum 63048 is that area that has the highest rate per 10,000. Many other areas have pretty similar rates around in the 200s. For our hospitalization data this week, we are once again going to take a look at the data we received directly from our local hospital systems. This report only includes data from 2 of the 3 main hospital systems, so please keep in mind that it's not complete, and it does not include every hospitalization from our county because we are still missing some data from one of our main hospital systems. In this particular report, we define the hospitalization as any time the hospital is utilized by a positive COVID-19 case. As of week 42, a total of 421 COVID-19 associated hospitalizations have been reported from the hospital systems for Jefferson County. 58 of these cases have been admitted to the ICU, and 28 cases required ventilators. In Figure 1, we see the COVID-19 hospital admissions and a 7-day average of those admissions. Hospital admissions always tend to follow the trend of the positive cases that we see. These admissions generally just come about 1 to 2 weeks after the cases are reported, I'd say. If we start to see another uptick in cases, we can definitely expect these hospitalizations to rise as well. The data we receive does have a slight lag, which is why you will always tend to see that steeper drop right there at the end of our graph. The admissions for the very end of the reporting week may not have come over to us yet. And overall, I'd say that we need to keep an eye on this depending on what the next couple weeks numbers bring. We like to include this information partly to make you aware of our hospital resource availability in the area. I would highly recommend checking out the St. Louis Pandemic Task Force report because Jefferson County residents do tend to utilize the hospitals in other counties and vice versa. So their report of the overall resource availability in the St. Louis metro and surrounding areas will give a pretty good picture of what's happening in our hospitals as well. Next, we will take a look at the length of hospital stay. And we have had a cumulative total of 166 emergency room visits. There are currently 15 Jefferson County residents who are still in the hospital at either BJC or Mercy facilities and are COVID-19 positive. Most of our hospitalized residents are staying in the hospital for around 1 to 2 days, but there are a fair amount of people utilizing the hospital for 1 to 2 weeks as well. Next, let's look at the current school-age population data. As of week 42, there have been a total of 750 lab-confirmed improbable cases in the 0 to 19-year age group for Jefferson County. In Figure 1, we see the number of confirmed improbable COVID-19 cases by week for the 0 to 19-year age group. During week 42, there were 42 cases reported, which is an increase from last week. Yet you'll notice that it is a very nice decrease from week 38 when there were 95 cases reported. In Figure 2, we have the cumulative cases and active cases by zip code for our 0 to 19-year age group. Let's focus on those orange active cases, so the cases that have not yet been released from isolation or quarantine. And all of our zip codes have 10 active cases or less, which is always good to see. Lastly, let's review the weekly community-based surveillance report, which excludes long-term care facilities. In Figure 1, we see the weekly case count excluding the long-term care facilities, and during week 42, 328 cases were community-based cases. Only 18 of our cases this past week were found in the long-term care facilities, and those cases do come from both the residents and the staff of the facilities. When we look at the age group data for our community-based cases, once again, that 20 to 29 year age group has the most cases with 859, but the 50 to 59 year age group is actually not too far behind and has a total of 807 cumulative cases. The 20 to 29 year age group has the highest rate per 10,000 when we exclude the long-term care facilities. And the last of our graphs we will look at today include the zip code data excluding the long-term care facilities. The areas that you will see with the highest number of cumulative cases in the community are Arnold, 63010, DeSoto, 63020, Festus, 63028, and Imperial, 63052. These areas all have above 400 cumulative cases, but there are a few areas that follow closely behind with totals in the 200s and 300s as well. Thank you all for listening in and watching our stats report this evening. Please be sure to refer back to our website, jeffcohealth.org, for more details and recommendations on COVID-19, and refer to the COVID-19 dashboard on our site for all the latest data. Leave us any questions that you may have in the comments and reach out to us via direct message. Have a safe and healthy rest of the week, and thanks again for spending this time reviewing the stats with us. Have a great night.